Good day, my name is Beverly Sinsuyan, and today I will be presenting my final year project entitled Effective Parental Training on Behavioral Management for Children with ADHD. First, I will give an outline of my presentation, which includes Chapter 1 Introduction, Chapter 2 Method, Chapter 3 Results, and Chapter 4 Discussion. So in Chapter 1, I will be introducing about ADHD. ADHD is a common neurodevelopmental disorder, and according to Barkley 1997, ADHD can affect behavior, cognition, and also motor skills. Next, DSM-5, which also stands for Diagnostic and Statistical Manual of Mental Disorder, 5th version, mentioned that ADHD happens to anyone, which includes children, teens, and adults, and the levels of severity varies according to individuals. Prolonged of untreated ADHD can cause comorbidities or co-occurring of other mental disabilities. So according to a global statistic recorded, there are 5 to 10% of children that are suffering from ADHD, while in a Malaysian statistic, there are a prevalence rate of 3.9% recorded by AVA 2014. The problem statements of my study is the literature on ADHD are across the board. However, the role of parents in supporting ADHD symptoms among children with ADHD has not been intensified. Understanding the role of parents in psychoeducational support of children can help in teaching children at home. And next, most of the therapy and intervention are conducted by professional therapists. However, parents also need to be involved in training, especially during this pandemic season. This is because parents are children's first teacher. Despite the danger of prolonged ADHD, parents still lack of awareness. Family with high social economic status will often rely on therapies to train their children, while family with lower social economic status often neglected the needs of their children with ADHD. Next is my research objective and research questions. So my RO1 is to identify the effectiveness of practicing psychoeducation as part of an intervention program for helping children with ADHD. And the question that I raise here is, what are the evidence-based study on the effectiveness of practicing psychoeducation as part of an intervention program for helping children with ADHD? And my research objective number 2 is to examine the interventions and therapy programs suitable to be conducted in home setting. So what are the intervention and therapy programs suitable to be conducted in home setting? My third research objective is to investigate the parental role in providing training and behavioral management of children with ADHD. And the question that I raise here is, what are the parental role in providing training and behavioral management of children with ADHD? The chapter 2 of my study is method, and the method that I have used in my study is comprehensive literature review. This means that this study is completely depending on literatures. The total number of publications that I have used in this study is 102, while 72 publications out of the total number of publications, 72 publications is used for analysis and comprehensive review for the findings part. So the analysis that I've done is types of analysis is on case study, journal, article, books, and bibliography of related to main articles. And that the keywords that I have used in searching for the related literature are ADHD, intervention, behavioral treatment, parental role, impact, effectiveness, comorbidities, psychoeducation, and behavioral management. The scholarly search engines are Mendeley, Skyhub, Book Google, Emerald Journal, Sage Publication, Google Scholar, and Universe Library Apps. So from my method, I have built 3 method tables according to my 3 research objectives. So each research objective has its own table. For example, my RO1 will be related in table 1, which is the psychoeducation as part of an intervention program for helping children with ADHD. So here I have, under my topic, there are 2 subtopics, and then the main findings of my article will be focused on topics, articles, age group, focus group, mental disabilities, and also the key findings. This same goes to table 2 and table 3. But table 2, there are extra part, which is the types of intervention, because in table 2, which is family intervention for children with ADHD, we'll be more focusing on types of intervention that are available for children with ADHD. And the third one will be the parental role in behavioral management of children with ADHD. Next is the results. As I have mentioned earlier, there are 3 findings, which will be the main point of my results. So the first one is psychoeducation as part of an intervention program for helping children with ADHD. So the first subtopic will be an overview of psychoeducation. So psychoeducation is a therapeutic program that focuses on delivering informative communication and coping skills to patients and also their families. So basically, psychoeducation is delivered by professionals, for example, child psychologists, therapists, and interventionists. And the party that involved in psychoeducation does not include only children, but also parents, teachers, and also caregivers. Some of the findings that I found regarding the benefits of psychoeducation is it reduces parents' stress level by gaining knowledge. This is because when parents have the knowledge, they are more well prepared to assist their children with ADHD. And next is through psychoeducation programs, teachers, therapists, trainers, and child psychologists, they can assist parents in providing the best psychosocial intervention and behavioral management techniques to train their children, especially children with impulsive, hyperactive, or inattentive behaviors. The second subtopic of my first main point is effectiveness of psychoeducation program. So the first effectiveness of psychoeducation program is it reduces internal stigmatization. This is often felt by children with ADHD because they face social exclusion. So when they face social exclusion, they are being stigmatized. So through psychoeducation program, it can help the children to understand more about themselves and they will not be facing the impact of stigmatization too much. And the second one is it reduces problematic behavior or ADHD symptoms. Parents and children, they have better awareness toward ADHD, and also studies show that they have better medication adherence or compliances. Next, it also improves social skills, but according to my research, I found that a psychoeducation program does not improve social skills because psychoeducation is only an effective program for delivering social skills knowledge. So for children to improve in social skills, they need to have the knowledge and practice the knowledge in real life. And that way, only then they will improve their social skills. The second main point that I will be presenting is family intervention for children with ADHD. So here I will be talking about types of intervention program that are suitable to be conducted within a home setting and by family members. So the first subtopic is parent-led behavioral therapy programs. So parents, they are not just guardian, but they are also teachers, educators, and trainers of their children. So the first parent-led behavioral therapy programs is ABA. ABA stands for Applied Behavioral Analysis, and this is a methodical technique for analyzing behavior and using the analytic behavior principle to improve behavioral problems and developmental disabilities. So ABA is focused on the role of behavioral therapists. Behavioral therapists, they play a role in designing the best intervention to help children to control their behavior across different settings. Because different individuals, they have different needs or they portray different types of symptoms of ADHD. That's why different children, they have different needs of intervention. But according to Demchuk et al. 2020, there are few ABA-based teaching strategies. The first one is using a diverse range of triggering techniques. These few examples are stimulations, gestures, verbal, spatial, and also different degree of physical cues. And the next one is breaking complex behaviors into smaller components, such as task analysis. And the third best teaching strategies is to encourage desirable or novel behaviors. For example, social praise, activity reinforce. Example of activity reinforce are such as watching TV, sleep, or play. And for tactile reinforce is the use of points, stickers, tokens, or coupons. The second example is relationship developmental intervention. So in RDI, it is a parent-centered cognitive developmental strategy in which primary caregivers are taught how to deliver ongoing opportunities for optimal functioning progressive in challenging dynamic systems. So for RDI, it focuses on relationship between children and parents. For it to work, first they must understand the parenting styles. There are 3 parenting styles proposed by Mokhadam et al. 2013, which states that there are authoritarian types, permissive types, and also authoritative types. So after understanding this, it shows that parenting styles can affect ADHD symptoms. It is suggested that it is best for parents to avoid permissive and authoritarian parenting styles. This way, they can help children with ADHD to cultivate a better relationship with parents and caregivers. And the main point in RDI, as I mentioned earlier, is building relationship between parents and children. So PCIT program, it allows parents to be directly coached by a therapist on parenting skills and use the data to facilitate treatment and measure family development. The next subtopic is game-based therapy. Here, I will be emphasizing on tools that are available for children with ADHD. Play therapy is important because it allows children to express themselves naturally, and active collaboration between parents and children can help parents to understand their children more and to build relationship. So the first type is digital health intervention therapy, which is gameplay that are available online or in play stores. An example is MyTear and Endeavor RX. And another type of tools is the conventional play therapy, which it has 2 types: play therapy with preschool children and play therapy with school-aged children. The play therapy is different because the cognitive processes and capability of active engagement of children with ADHD are different at different ages. Next is the third main topic, which is the parental role in behavioral management of children with ADHD. So first, behavioral therapy is important because it helps children with ADHD to control their behavior, to have self-esteem and self-control. And the younger the children that are exposed to behavioral management therapy, the treatment will be more successful. And it will be more successful if it is conducted by parents themselves. The first subtopic here is parental training in behavioral management. So according to Bjornbeck et al. 2015, it is important to train children with ADHD. Parents must be well prepared in knowledge and competency. Therefore, it is important for parents themselves to gain parental training in behavioral management. So according to PMTO, Parent Management Training Oregon Model, it suggested that there are 5 core in parenting practices, which is encouragement, such as through positive reinforcement or skills encouragement, problem solving, to resolve conflicts or to set house rules, limit setting or discipline. This is to encourage deviant conduct to discourage this deviant conduct by using moderate penalties appropriately, and this gives children the clear limits for expected behavior. Monitor or supervision, this is on potential involvement in dangerous behavior. And lastly is the positive parental involvement, such as parents need to express their care, their interest, their concern and attention towards children with ADHD. The second subtopic is parental role as teacher trainer. So here, usually parental role can be strengthened through the mindfulness program, where it is a program that allows collaboration between teachers and parents. So teacher will be teaching students, and also at home, parents will take the role as a teacher. Through mindfulness-based intervention, the goal is to help parents improve stress level, mindfulness, and encourage positive psychosocial interaction when caring for children with ADHD. This program is often provided by schools and mental health organizations. Joining this program, it doesn't take too much time commitment, and also at the same time, psychoeducation is also provided for parents. The third subtopic here is parental role in disciplining. Acceptance toward discipline is harder for children with ADHD compared to normal children. So it is important that children with ADHD to have good relationship with their parents. In that way, they have higher tendency to trust, to believe, and to obey their children. There are a few techniques in disciplining children, and the first one suggested is positive reinforcement. And the second one is to make clear rules and expectations. And once the rules is established, it is important to conduct a repetitive enforcement. And also the last one is discipline through experience. This is because children with ADHD, they cannot rationalize or think through the consequences of their behavior. So it is important to give them discipline through experience rather than speech. The last part, which is chapter 4, is discussion. Under discussion, I will talk about limitation and conclusion of my study. limitation, the first one is publication bias, which is there are possibilities of exaggeration of positive outcomes when the findings do not include any neutral or negative outcomes. And the second one is time constraint. So there is not much time available for all the publication to be explored. And the third one is access, since everything is done online. So information and publication can only be accessed online, and there are also limitations to access some documents on internet, especially ebooks related to parenting skills. And the last one is lack of publication. This is because my study involved the focus on parental role, and there is still lack of publication regarding parental roles toward children with ADHD. And the last part is conclusion. I want my study summarized the importance of parenting skills, knowledge, and what to expect when nurturing children with ADHD. This way, it also helps parents to be confident and be vigilant on the do's and don'ts when handling children with ADHD. And effective teaching tools are given for families of all economic status and academic backgrounds. And last but not least, it provides quality reference and guidelines. That's all from me. Thank you.